Thank you so much, Mark, for having me today. It's lovely to be here.
The this conversation today, the title of our show is the pandemic's effects on global health. And as we were talking about this, you had suggested that, we're now in our third year of COVID, and with the world's attention on that, yet there are all of these other diseases that have been impacted as a result. And I didn't really understand that. And I think our audience probably doesn't either. So maybe we can start there.
Absolutely. Thank you. So, obviously, COVID has grabbed a lot of headlines over the last 3 years. It's become part of our daily lexicon. It's disrupted every aspect of all of our lives here in the US. And the same is true for all people all over the world. I think what's been underappreciated is the effect of the pandemic on other health conditions that have been neglected in a lot of ways, not only by media attention but by resources. There's been a lot of shifting of resources
Oh.
to COVID, and rightly so. But at the same time, like many other conditions, global health conditions have been neglected, and that includes communicable as well as non-communicable diseases.
So I know that there was a worldwide effort to find vaccines, and did you notice there at Yale that there was a huge shift, or is it there and you've noticed amongst your colleagues and you've been paying attention to that?
Yeah, I think there's a lot of people, colleagues, scientists, public health practitioners who have devoted their time to COVID-19. And again, appropriately so, this is a completely new entity that needs scientific and public health attention. Some people have left their previous fields of scientific inquiry and
Mm.
now have shifted completely to COVID. Some people are doing both. What they used to do as well as COVID. But again, I think a lot of um, scientific thought and resources have shifted away from other health conditions, and to the detriment of people who suffer from those conditions.
As a layperson, it feels like we have a handle mostly. I'll just say mostly. Now we have vaccinations, we have protocols, we have it feels like the numbers are going in the right direction. It's no longer a global emergency. I don't know, is it still officially a pandemic?
Yes,
Okay.
pandemic is not over. You're right. We have made a tremendous amount of progress, and I admire my colleagues in science and medicine and public health who have done so much over the last 3 years to understand and combat COVID-19 and to the betterment of the U.S. public health and global health. We have learned so much about this virus, about the biology, about the public health, about how to prevent and treat this condition. Um, it's been astonishing the amount of progress that we've made in the last 3 years, honestly, compared to other health conditions that have affected the global population in a extraordinary way. Um, Almost to the extent that I'm jealous of the attention as someone who studies other kinds of pandemics. I'm almost jealous of the attention that COVID-19 has received. And certainly of patients who have lived their entire lives with, for example, HIV, who said, how come, there's been so much attention to COVID, and they found a vaccine within, just such a short time. And I've been living with this other virus for 20 years and still no vaccine. And I can understand that sentiment completely, because there's been just this coalition of science that's come about on a global level that was really unprecedented and quite impressive, to kind of understand COVID in a way that has not been applied with other medical conditions.
So with these other things like tuberculosis and HIV and diabetes and cardiovascular disease, um, who's studying the impact of COVID on those? Because I've got to guess that's exacerbating one or the other. Am I right?
Yes, absolutely. So you have people who study HIV, people who study TB, who are seeing the effects of the pandemic on these conditions, not just on a well, I should say on both a epidemiologic, grand scale, looking at the numbers, looking at patterns across countries, but also on a more individual level. How does COVID actually affect someone's tuberculosis?
Right. That's what I'm interested in hearing.
Risk of how does HIV affect the risk of COVID, for example, or exacerbate it? And so we know that COVID increases the risk of all these conditions on a public health level, but on an individual level, we know that diabetes, we know that HIV, conditions like hypertension, cardiovascular disease, all of these conditions increase the risk of COVID, severe outcomes, including hospitalization and death. The multitude of these conditions exacerbates the risk of bad outcomes. And so, that's true in the US, that's true all over the world.
We've been studying COVID for 3 years now, right? How many years have we been studying tuberculosis?
A couple hundreds, and the amount of progress we've made with COVID is astonishing compared to what we've learned about tuberculosis. To be sure, we know a lot about tuberculosis at this point. We know how to diagnose it. We know how to treat it. With treatment, outcomes can be a cure and successful in the vast majority of cases, but treatment is lengthy. And so it is difficult to manage. We know how to prevent tuberculosis. Yet, despite all of this knowledge, we still have 10 million cases of active tuberculosis every year. And when I say active tuberculosis, I mean when people become actually sick with tuberculosis infecting their body, causing symptomatic illness, and that is transmissible to other people. And so it is a respiratory pathogen of great public health concern. And it is the leading cause of infectious death around the world and has been for years. Before COVID, tuberculosis was and is the leading cause of infectious death.
And that number is still the same. COVID overtook it, and now COVID, they're co-equal, or?
No, COVID has overtaken it. I think we have more than 10 million cases. The incidence of tuberculosis is increasing, but it's still 10, 11 million cases every year, and COVID has surpassed that, unfortunately.
I'm curious, again, as a civilian, what is it? Is it media attention that helps? Is it, what is it? Is it lack of funding? Is it a lack of resolve? What is it that keeps us from solving these? I mean, again, with COVID, you had the world on this. Why is that not the case with these other diseases that are affecting millions of people?
Oh, that's a very good question, Mark. And I think a lot of people struggle with this. I think it depends what it is, what condition. I think certainly with tuberculosis, and to a certain extent with HIV as well. These are conditions that affect certain populations in particular. And so it's very segmented in how we think about the public health for these populations who are at the highest risk. Tuberculosis in particular affects people who are poor and vulnerable, people who are malnourished, people who are otherwise immunocompromised, people who have other health conditions that make them more vulnerable to acquiring this particular respiratory pathogen. They don't have a lot of ability to speak up for themselves and advocate for themselves. And I think the TB community has done a lot, but overall has been neglected. I think the HIV community has done a somewhat better job historically in terms of advocacy, being a new entity, similar to what we've seen with COVID, in the 80s, there was a lot of advocacy that went along with that because it affected a very, affected largely men who have sex with men, who became a very vocal self-advocacy group along with it. So I think it really depends with each epidemic, so to speak, that we're talking about, who it affects and how much advocacy goes along with it.
So seeing
Of course,
how, oh,
and
sorry.
of course, I was saying, of course, HIV has not been limited to men who have sex with men; has expanded to all sorts of global
Right,
population,
right.
and so that's everybody.
It's also not just in the poorer class. It's
Exactly,
classless in its approach, right?
exactly.
So is there been anything that we've learned in our approach to COVID? Because again, it was remarkable the way it worked, that we might think of as maybe trickle down to be applicable to working with these other diseases. Is there anything we learned?
Learn from COVID.
Yeah, through the effort,
Mhm.
like if we were able to direct all that effort at some of these other challenges like cancer, for instance.
Yeah, no, it's a very good question. I think it was amazing to see the global community come together in the global scientific and public health communities come together in such a meaningful and substantial way. There was so much data sharing. There was attention every single day. The government was on TV providing an update every single day. So
Right.
there was like immense pressure, um, not to mention the resources that followed it, because this was having such a toll on the entire world. And so that kind of attention and pressure on an ongoing basis, I think, leads to resources, that leads to um, positive scientific progress.
So let's I tell me, what percentage of the people you're treating right now in New Haven have COVID? Is it just dropped to very small number, or is it
Well,
higher
slowly,
than we would
yeah, I mean, the hospital numbers are starting to come down, thankfully. We think a lot of institutions experience a surge over the winter. Thankfully, we're starting to see those numbers come down.
are we are there again, because it's not in the news all the time, I don't know the answer to this, but we had various strains that came in, variants that came in. Are there is it the kind of thing where there are now thousands of those variants, or just a few very strong ones?
No, there are multiple variants. They come in waves. The
Mm,
latest variant that really kind of took hold and is responsible for the majority of cases at this point is a weaker variant. And I say weaker only in that it causes relatively mild disease compared to what we saw initially when COVID came onto the scene. Weaker than, for example, the Delta or Omicron,
right.
the initial Omicron variants. From a little over a year ago. And so, I think it really remains to be seen how many new variants arise and how long this pandemic keeps going. I think, unfortunately, as I think there was a lot of global cooperation
Mm,
first year or two of the pandemic. And as attention falls away, resources fall away from COVID as a global threat, that scientific consensus building, the scientific cooperation also falls away. And it continues to be a threat. These variants will continue to arise. Um, the research may not be there as strong as it was before. The public health efforts to vaccinate, to get people diagnosed, to get people isolated, to limit transmission, all those things limit the emergence of new variants. And unless we continue to have public health pressure on all of those areas, we'll continue to see COVID, and the pandemic will continue.
it feels like everybody is, I mean, they're tired of it. right? To just, right? They're just tired of it. All of the mitigations and all of those things. And now it feels like everybody is kind of back to normal. Yet I'm getting this sense that maybe it's not back to normal. It's still there. It's just not as much.
Yeah, I mean, the pandemic is not over. I think there's a tremendous amount of COVID fatigue. People
That's
are
the
tired.
word. That's it. COVID fatigue. Thank you. That was,
Um, and that's understandable. It has such a disruption in our daily lives for so long. I understand people wanting to get back to their normal everyday lives. Um, Unfortunately, the reality is that this is still with us. And thankfully, this latest variant causes a milder illness. But there's always the potential for the next wave to be more severe. And so I think we have to be prepared for that. I think having lived through the last 3 years, hopefully everyone is prepared for what that potentially may mean. Although I worry that the COVID fatigue will make some people complacent.
I get that sense that they'll no, that I just get that sense. No, it's everybody. It's a media hype, or
Right.
there's a lot of there was it felt very fringy at the height of the pandemic when when people were just saying, we're not going to do masks, we're not going to vaccinate, we're not going to do these things. It felt fringe. But now as the government has said, hey, it's not an emergency anymore, and we're now not funding sending testing kits, we're pulling back those funds. And I guess as a researcher and a clinician, someone does that worry you a little bit?
Oh, certainly. And I can understand them stepping away from calling it an emergency. It's not an emergency. I understand that, like it was in March 2020, but it is still a major threat to the U.S. health, and to global health. I mean, we have not defeated this virus, and it continues to affect us on a daily basis.
Dr. Shenoy, thank you so much for helping us understand this incredibly complex issue that's affected all of our lives.
Thank you.